cat, this is the trachea, and this is the right and the left common carotid. Now, this is very important because if you'll see, there's a little tiny nerve right here running next to the common carotid. That's your vagus nerve. The nerves look like little tiny white fibers. And so there's your vagus nerve there, and there's your vagus nerve here on this side. It follows the carotids, okay? Again, your trachea, and below your trachea, if you come and you lift that up and you go below the trachea, you're going to see a muscular tube back here. This is your esophagus coming down back here. So the esophagus is behind the trachea, and it looks like a muscular tube. Now, coming out of the heart right here, you've got the cat is different than the human. You have the trunk here, and you have the you have the subclavian coming off here, and the right common carotid, and then you have the left common carotid in the cat. So you have 3 branches coming off in the cat, 2 in the human, and then here from the arch you've got the left subclavian. Now the veins coming back in, you have got the subclavian here, and this is going to be your jugular going up into the cat's neck. So wait, here. No, there's the, I'm sorry. Where is the jugular coming off at? That's the subclavian, and here's your jugular coming off. So you've got the jugular here and the subclavian going there, okay? And then this is your brachiocephalic on the right and the brachiocephalic on the left, and that turns into the superior vena cava going into the heart. You can see the superior vena cava. Now this nerve coming down here, this is, let me see if that's your phrenic. That's your phrenic, because see how it goes there, and the phrenic nerve is going to end up, it's going to come right down in here. There's your phrenic nerve going to the diaphragm. So it comes right down here along the side of the heart, and then it goes to the diaphragm. This happens to be your inferior vena cava coming to your heart. So you've got the superior and inferior vena cava. Now this is the lungs, and on both sides, and then I think it's on these are your veins, the thoracic veins. This is actually the sympathetic trunk right here, the sympathetic nerves right there alongside. Now let me see if I can find there it is. There's the azygos. The azygos goes along the back wall here, and the azygos comes up here, and it goes into the superior vena cava. So you can see your azygos going right along there. Okay. Now, of course, lungs and heart, and this is the phrenic nerve on the left side, the little guy coming right down there into the diaphragm, and you can follow it alongside the heart right there. That little thread going up right there is the phrenic nerve going along down to the diaphragm. On the other side of the diaphragm, you have the liver, first of all, and this little hole here is where the gallbladder lives. That's the gallbladder right in there. And so you have several lobes of the liver, and the liver kind of sits like an umbrella right on top of the stomach. Now the stomach has a greater curvature and a lesser curvature, and the greater curvature has the greater omentum. So this is the fatty apron that goes down around the intestines. The lesser curvature has this little bitty piece of fatty tissue up here called the lesser omentum right there.
So that's the lesser omentum.
Okay. This is the lesser omentum. This is the greater omentum. And in the greater omentum, you can see that the spleen, it looks like a dog's tongue. So this is the spleen coming down here. And if you pull this over, obviously you've got the kidneys there. And you can see the inferior vena cava, and the aortic artery looks like that one. And then this right here is your adrenal gland, or your suprarenal. And in the cat, it's right underneath this little vein here. It looks like a little white bean. So that's the adrenal. And coming out of the hilum of the kidney, you're going to find the ureter. if you trace this ureter, it's going to go all the way down here to the urinary bladder. And so here's the ureter coming here. And so if you pull that out, you'll see that it comes up here and it goes into the hilum of the kidney. It goes in with the renal vein, and there is a renal artery in there somewhere, if you look. It looks like the arteries are not injected real well in this cat, so you don't see them real well. So you'd have to find another cat. Oh, that looks like the artery going right in there. There's the renal artery going in there. See the red part? Okay. So this has got nuggets. Most all the cats have been male, so when you look down here at the urinary bladder, you're going to see these little threads coming off right here. These are the vas deferens. This is the vas deferens right here, coming on either side of the urinary bladder. This is the urinary bladder down here at the end. Now, the intestines, we go from the stomach. And as the stomach comes around, curves around this way, it's a J shape. The duodenum is actually going to come around this way and curve back towards the stomach. Now, this is the duodenum because it's the small intestine coming from the stomach. So here's the stomach and here's the duodenum. Now, the thing that you're always going to find in the crook of the duodenum is the pancreas. There's the pancreas right there. This tissue is pancreatic tissue, and you see it better on that side. Awesome. That's the pancreas. So the duodenum will always have the pancreas associated with it right there. Now, if we asked you to identify this part of the small intestine right there, a pin right there, you automatically look and see the stomach, so you know that's the duodenum. And if I ask you to identify the ileum, it's going to be connected to the large intestine. So this is the large intestine right here, and this part would be the ileum. Now, if all of this is just laying there like that, and I've got a pin somewhere in no man's land, it's jejunum. Jejunum. So the ileum will be connected to the large bowel or the large intestine. So this is ileum, there's the large intestine, and this pouch at the end is called the cecum. So this is the cecum. Now, I call the intestines over the rainbow, and I'll show you why. And you see they're all connected to the back wall by this mesentery stuff. See, it's all this mesentery connected to the back wall, all of your intestines. Now, if you look here, this is your mesentery. Now, you see why they call them mesenteric arteries? Now, in here, you can see yellow, blue, and red. The yellow is your hepatic portal system. And the blue is the veins and the red is the arteries. But all through here, you have mesentery. So these are your mesenteric vessels, okay? So now, again, I say that the large intestine is over the rainbow. Now, if you picture the large intestine as a picture frame, so here I've got ascending, transverse, descending, and when it kind of squiggles here at the end, that's the sigmoid colon going down to the rectum. So the straight part is the rectum, but this little zig here, it's kind of subtle, is sigmoid. But you've got the ascending, transverse, and descending colons. Now, the intestines sit kind of right inside of that. The duodenum comes back under here, and it comes up here and then starts the rest of the intestines. And so then they just kind of sit right in the middle of your large intestine. And if you look at your models there, you can see that the large intestines are coming up and around and sort of picture frame your small intestines. And so you're going to have to dig a little bit and find the hepatic portal system. See this yellow right here? We're going to have to go in here and find this big yellow vessel right here, right there. I think this is yellow. Let me see if I can find a yellow vessel going up there, because that's going to be your hepatic portal, this inferior, there it is. See that? The inferior mesenteric, and it's coming up here. So let me see if we can trace this. This big yellow thing, that's your inferior mesenteric coming up there. It takes a little bit of work to see this guy. This is coming from your small intestines. This is your inferior mesenteric coming up here. So you kind of have to trace that as it goes up towards the liver. You might have to open up some of this and find the yellow part. Now, coming from the stomach, coming from the spleen and the pancreas, you've got another mesenteric artery. Oh, this is the inferior mesenteric right here. This is the inferior mesenteric. And this inferior mesenteric is going to come up here and join the splenic. So here's the inferior, and so you look where it joins the splenic, and also the pancreatic. So the spleen and the pancreas have a vessel coming along here that's going to join the inferior mesenteric somewhere. So you have to kind of find that yellow blood vessel coming out of the spleen and the pancreas. You can see the pancreas comes all the way along here. That's part of the pancreas, and that's part of the pancreas.
Oh, wow.
So the head is always around the duodenum, and then the tail goes out that way. So once again, there is a yellow vessel, and I can see yellow right here, but I'm not sure if I can trace it real well back all the way up here. But again, the inferior joins the splenic, and then they join the superior, and then they go up into the liver as the hepatic portal vein. Okay? That's about it.